Join me in the pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Public comment. Do we have any public comment today? Seeing none, we'll move on to the approval of the consent agenda. Has everybody had a chance to read the minutes? And we've already submitted the calendar for check signing.
I will move we approve the consent agenda as presented.
Second.
Moved and seconded to approve the consent agenda as presented. All in favor?
Aye.
It passes unanimously. Moving right along. Cheryl, the 2017 July financial report with the new pretty colors that
Good, I'm glad you like it. All right, so I really have mostly good news, and since it's the first month of the year, we don't have like a lot of comparisons other than the average of last year. So, where's my phone? Oh, this thing is dead. I thought it, okay. So, well, I guess I can do that. Okay, so here it is, July, 362 patients. Last year at this time we were at 397. However, last year's monthly average was 367, so we weren't really very far off. And as usual, the big variances with the ED. Surgical was down. We had some vacations in our doctors, surgical doctors, so that slowed us down a bit. Ancillaries, on the other hand, was way up, both year over year and above average, honestly, for everything except PT. And even though that variance looks big year over year, they were just a little smidge behind last year's average. They were still pretty busy. So all in all, we had a pretty decent month. And when you look at our average daily census and our swing bed and our length of stay, it continues to very slowly go down. Oh, thank you. Welcome. Okay, so gross patient charges is right here. A little start because I can't show the line. The charges for the month were $2.85 million. Last year's average was $2.6 million, so we had good revenue this month. Our collections on AR were good. Is this number here? And that number is $2.15 million. We've had bigger months, but still it sticks out. Average last year was $1.8 million just about, so it was a good month for cash collection. Our days in AR dropped again to back down to 68 and a half, so still we're looking to be down here at 60. The only thing I'd say about that is that we continue to be more focused on our eClinicalWorks AR, because we've still got some issues around that. We keep changing our minds about the best way to do things, and also the Credible AR has been a huge project. We've made a lot of progress, but we're still working on it. So Lisa still is not really fully focused on this AR, so I'm still expecting great things down the road, but we do have a lot of, she had a lot to do, so we're making progress. Our days cash on hand, this 90-day line is where we need to not go below for the WAFET covenants. This month we're at 102. Oh, you know what, this month is not on there because I screwed up. We're at 102, so it would be right there. We're in the process, we've submitted the bond paperwork for the next bond draw, it's $900,000. And we have a GE lease that's in the process of finalizing for $270,000. So when you add those dollars back in, we go up to it brings us up 20 days, so 122, so that's good. And I should get that cash before the end of this month.
What's the lease for?
It's a whole bunch of, it's all of the things, this is taking forever. It's a lot of that ortho equipment. We decided to lease the long-term stuff. This was several months ago, but they were not able to provide us with all of the promised pieces and parts. And so the lease couldn't close because we didn't have everything. And then we added that,
The lift
yeah.
for the construction.
Forklift, is that what it is? So, anyway, it really hasn't changed any, it's just taking forever to close. So, we finally got all the parts from Cynthi's for that workplace. So that'll be happening in the next week or so, I expect. Okay, so our profit and loss for the hospital for the month, we were $270,000 below budget. Definitely, a lot of that has to do with the surgical vacations and slow ED. Acute was down again, but this was kind of bolstered by the ancillary services. Salaries, we were $200,000 under budget. I mean, that's partly because when we budgeted, we planned to hire several people, and that will take time. And it's partly because we still have a lot of temp labor instead of perm labor. So this I expect will go down over time. Materials and services were $140,000 below budget, and I think that's partly a function of lower productivity than expected. And benefits are not far from where we expected they would be low because we don't have as many employees hired as we might have. Anyway, so it comes down to the total. The operating loss for the month was $90,000. We budgeted for $210,000. So our net gain for the month was $110,000, which is $99,000 above budget. So that was a nice start to our new year. This is our balance sheet for this is a prior month, June, this is July, this is where we were a year ago, July. Year over year, the cash has come up. The fixed assets is up because we have been borrowing on that construction. So then also is our debt has gone up because of the construction. And we don't really have a lot of other major impacts. Cash is up more because days in AR is down than anything else. I mean, we didn't have a huge profit to bank, but we did lower our days in AR, so that brought in some extra cash, and we still have some more room to go there. Okay, any questions on Lake Health District? So then, I guess before I move on, there were a couple of policies sent to you, and the only changes in the policy was an update to bring these, to bring this table to the new federal published poverty levels. So
that was the change.
that's the only change.
Okay.
Everything else is the same.
I was trying to find a change, I couldn't find it.
Yes, and it's super important that we stay current on this, because this is the thing that the IRS is perusing your website to see if you're compliant with, so they can take away your nonprofit status if you're not. So it's really important for us to stay up on that. Okay.
Do we need to have the board approve the policy?
Oh, well, they have to sign it too. Sorry, yes, you do.
approved on.
Okay.
We would request that the
Oh, I
board
see.
approve.
I was moved that we approved the 2 policy changes.
I'll second that.
It's been moved and seconded to approve the financial assistance policy and the private pay services policy as presented. All those in favor?
Aye.
Passes unanimously.
Okay. And then one other thing that I want to talk about briefly is that I have been in discussions with Walt Davis from Edward Jones, and he is based in Alturas, and he would like to be our broker of record for our pension plan. And I am very excited about his ability and enthusiasm to come up here and educate our employees and work with them one-on-one and be available for meetings whenever they want, so that we can encourage and increase our retirement savings for our whole group. We've been working with D.A. Davidson for a long time, And they come down once a year and are available if our employees want to call or to come talk to them. But they really have not been proactive at all. So the main thing I was looking for and was excited about was better service, more one-on-one, face-to-face with a retirement advisor. The second piece of it, which is not small, is that it will save us, the employees will save many thousands of dollars. So I think we're going to get better service for less money.
The savings will occur because of lower.
And it'll, yeah, so it won't come out of your retirement. They're not like really going to see it or be very aware of it because it comes out of your funds as the money's coming and going. But the fact is, it is going to reduce the expense for people.
Okay, thank you.
Okay, so then Goose Lake. Lakeview Gardens had another great month. They're pretty much full and staying full with 24 residents. And so their long-term care days for the month was 741. Last year it was 670, so a pretty good year-over-year increase. The revenue was also very good for the month, 217,000. Last year, their average was 187,000. Obviously, we expect that number to maintain and grow. I mean, as soon as we add the olive, it's going to grow, but I would say that it's looking pretty positive that long-term care is going to stay full.
Yes.
Yeah.
We're at 100%, right?
Yes, we are.
Now, when you add assisted living, is it all going in the same bucket?
Yeah, it needs to. We could break it down. It
Just for
is,
education purposes.
right, we could definitely, we will certainly have the ability to break out the revenue and expense, I think, to a large extent, but it will be in the same set of financials, same income statement and balance sheet. Okay, so the profit and loss for the month, you see, so the revenue year over year, prior year to date is quite a bit better this month, but again, the contracted labor was $34,000, and we had $8,000 worth of startup expenses. That number is dwindling fast, or I'm sorry, $7,000 of startup expenses, leaving our net at $1,000. So I'm very happy that it was positive. Since the residents didn't move until August, we are going to start recording rent monthly. I mean, so now that they're over there, the rent we agreed on, which kind of covers the cost of the bond payments and whatnot, is some, I think it's like $44,000. So that's going to make a bigger nut to crack. But, you know, the one, I think, saving good thing is, and I'm not sure that long-term care is going to be able to afford that right away and have a positive bottom line. But the way the auditors are putting our financials together with the component units, that's going to just kind of be washed, which really it should be.
Is the
So,
contracted labor going to stay that high?
We're hoping not. We graduated seven from the CNA class. 6 are hireable. One was under 18 until in November, and then she will come on. So they're started orientation last week, and they're testing the 28th or
27th.
27th or 28th. So hopefully they all pass, and then they're able to be hired on to get rid of some of those contracted labor. Currently, we have 7 traveling CNAs right now.
Wow.
don't we have a whole new class started?
We have a class, scholarship interviews on the 18th, and orientation is the 19th.
I think we do.
And
And
she's
we
the only
also,
one who said she can do it for sure.
we also,
I said I would.
I'm-
Did anyone else want to do it?
We like having you.
we also
You
started
like
a
my
class at the high
questions, don't you,
school.
Leslie?
Did you guys hear me? We started a CNA class, or an NA class at the high school. And they actually start their labs on Monday. So we're running 2 concurrent classes.
How many people are in that?
7 from the high school.
Great.
That's awesome.
Proactive.
Okay,
Started
so,
early.
Goose Lake Medical had a rough month. Dr. Faber didn't come in till middle late of the month. So we are gonna have a tough time at Goose Lake as we are paying a very high price for locums. And hopefully that revenue number will come up. But you're bringing in doctors that don't have an established patient base, so it's not like it's going to stay level, like all of a sudden Gilbertson's patients are gonna go see our locum. Dr. Faber was not very happy in Alturas, and so he left and was replaced by Dr. Nurs. Everyone really liked him, he liked us, but he had another commitment, so now we have Dr. Eldridge, who's doing okay, but we're hoping that Nurs will come back on a more, on maybe semi-permanent basis. So it's going.
Is he a traveler?
Nurs or Eldridge? Nurs is a traveler, but he indicated he might consider a semi-permanent, he said that when he was here, but now he's gone, so we'll have to pursue that and see if he doesn't change his mind.
I talked to him on Friday, and he was very interested in coming back.
Yeah,
Do we know
On a permanent basis?
when he's going to be available?
not full-time though. I guess that's what I meant.
He's out for 2 weeks, and then he will be reaching out to us as soon as he gets back.
Okay, so then with the reduced revenue, which is big, and expenses, which are not low because we have temp labor and locums, we had a loss of 31,000 for the month. And balance sheet has not really changed much. AR is up and debt is up, but. Okay, Lake Health Medical Supply, again, another profitable month. I mean, it's only $260,000, but honestly, I mean, I'm very excited. That continues to be very positive. Hey, this is
No,
awesome.
I think it's
I mean,
good.
you gotta, this is, the tip of the.
I'm appreciating your excitement.
Yeah, because I feel like it's just gonna keep getting better, so I'm excited. And really no change in their balance sheet. Questions on that?
Okay. No other questions on the financials? Hearing none, we'll move right along to the scholarship discussion.
Oh, we're gonna skip that.
Oh, wait.
Didn't we have something
Oh,
else
are
with
we-
Lakeview Gardens?
Lakeview Gardens updates.
Oh, excuse me, I thought we were done. Fire away. Mr. Twait.
Actually, I'm hoping that Larry and Melinda can give us an update.
Lakeview Gardens, we moved in on August 6th.
Okay.
One of the main concerns when we first moved in was the food. So one way that we helped combat that was we hired Jess as our hospitality aid supervisor. So she's supervising them, training them, and making sure that the right portion amounts get put out for every resident, and it's going really, really well. Super happy with that. We graduated CNA class, which we mentioned. There were 7 in there, 6 are hireable. We're hoping that they all are hired on within the hospital and Lakeview Gardens in the near future, once they pass their boards. And as for the assisted living, we're wrapping up. We had our consultant come out last week, and we got a lot of work done with her. We went over our policies and procedures that Warren Bird, policy analyst at the state, had returned to us for, he had a couple questions about those. We got those questions answered and submitted back to him. And he's due for a visit on the 21st of September to kind of do a site walkthrough and kind of just check out the facility.
But you've answered all of his questions in writing already?
Yes, he submitted back to him.
Okay.
Once he comes and checks out the facilities, and when he's done with the reviews of our policies and procedures, that's when we'll know a clearer date on when we can move in. we're still shooting for beginning to middle of October.
Are we still, is there still consideration that there might be 2 or 3, a number of people that are in long-term care right now that could go into assisted living and open up some beds in long-term care?
Yes, and we currently have 3 people in the community that are in need of our skilled nursing beds for Lakeview Gardens, and we have 2 in acute right now that would qualify. So we have 5 people total looking for beds in Lakeview.
And we will probably fill assisted living also, correct?
Absolutely, we have close to 30 people on our admissions list still. So we anticipate, once we move those 3 residents from Lakeview Gardens skilled nursing into assisted living, we anticipate those 2 to 3 beds to be filled within the week with the people from the community in the hospital. So we should be full in a census at 36 shortly after we open.
Well, excellent, thank you.
There were a couple things in terms of Lakeview Gardens that were still outstanding for the state to improve. Remember, the facilities evaluation had to take place, and then we had the licensing when they came out. We're waiting for a final on the facilities, and they had a couple of restrictions that we had to do. We did the striping of the side of the parking lot, and another requirement was that we had to have all the landscaping completed, and that's why we have that fencing, because we didn't want to have any. We couldn't allow people to be using the facility with that large drop off between the sidewalk and where the grass would go. So we were supposed to have the facility complete, the landscaping completed by August 31st. The contractor was unable to meet that date, obviously, it's not done. Detroit is bringing in another crew to start work on it next week to make sure that we have it completed by the 21st when we have the assisted living inspector here.
Who pays the additional cost on the delay of the landscape?
That is part of, it's being taken out of the landscaper's contract. So there was a total amount that had to be paid. Has not been paid all for all the work that's been not yet completed. So he's been paid, like all the contractors, they get paid as the work gets done. So he won't get paid for the work that he didn't do.
So is he done?
Not completely. He's still involved. Remember, one of the things that holds true in the landscape contract is they have to warranty everything lives for a year or they replace it. So we're busy working to make sure that in a year, Droid doesn't have to replace a fair number of things. So we're trying to stand up. Any other issues related to the gardens that anyone has questions on?
Well, it just sounds good that everybody's moved in.
Right.
So
There have been some bumps, and we are addressing those. One of the things that I think everyone should keep in mind is when you have people that are in a long-term care facility, any kind of change is difficult. And so that has, we are seeing the results of those, of that change. Change is difficult for lots of us that aren't in long-term care facilities, but it creates greater confusion for the residents. It creates, and when you have confusion, that creates opportunities for fall or to have other things happen. We're addressing those. Some of that is unfortunately expected, some of it it's a change in how we are delivering service. So some of our staff members are also struggling with that process and learning where things are and how things work. not only what we do, but also members in our community. So historically, because we've been connected to the hospital, the patient, if they need to be seen in the emergency room, just have been rolled down the hallway. When we don't have that connected, we have to use services within the community. And that causes changes. So we're working through this. Okay? And if any members of the community have any concerns, please ask them to come talk to me or to Larry or Melinda so that we can address those.
Okay. Thank you, sir. Now, Leslie, scholarship.
Number 6 is being tabled.
There's number 6, we're after, yeah.
For table, that's going. We're tabling. We're not doing that tonight.
Oh, we're not doing
No, I didn't realize that was on the agenda for this evening, sorry. But we are doing Patricia King.
Okay. Okay, do the pursuit.
Patricia King. Okay, so we've actually had 5 applicants for the 2017-2018 academic year. You approved 2 at the last board meeting. They were Kelly Utley and Amy Howell. Okay, so in addition, I've got 3, and so I'd like to present all 3, if I may, together. Well, individually, but all in a row. Okay, so I'm going to start with Hope Arrington because she's actually in her final year, and she's asking for assistance in her final year. She has completed her first, let's see, how many years has she gone? 3, right? She's getting a bachelor's. So she's going into her 3rd year and doing very well. She has a 3.77 GPA. She has asked for the scholarship in her 4th and final year. And she is a Lakeview resident who plans on staying here long term. So Teresa could have another New Year's this time next year. Well, she's in Paisley, I'm sorry. It's close. They're, you know, it's like your neighbor.
School, is she at KCC?
No.
She's at OIT.
OIT. Yep. Okay, so we have 2 new applicants. One of them is Elisa Matthews, and she is going to go for her bachelor's as well. She's actually, she said she's going to go for her bachelor's in complete nursing school.
Oh, okay, but she's going to KCC.
Yeah, she's starting out at KCC, and she's actually a unit secretary in a cube right now. And she went to University of Phoenix, but her current GPA, her college GPA is 3.49. And she has been in Lake County for 7 years and plans to continue on. She's got a family here, so she is a new candidate that is applying for assistance and going through KCC currently. Then our last one is Steve Headland, who is a 4th generation Lakeview native, and his family has been around for quite a while, and this is the most impressive application I've seen since come in. It was typed out, it was absolutely complete and accurate. I didn't have to ask for any additional information, but he has gone to KCC 1 year. His GPA right now is 3.79. He graduated from Lakeview High School in 2015, and he had a 3.9 GPA, so quite a strong academic student. And he plans on starting a 4th generation family here. So he's been accepted to OHSU and is asking for assistance for this year as well, for the academic year. So we have those 3.
Can I jump in here? They did not approve Amy Hobble at the last meeting. We haven't received her application.
Oh,
the only 2 that they've received,
Oh,
the 2
okay.
that you've given me so far is Amy Hobble and Hope Arrington.
These have come through too and sent to you. So you, yeah.
How much
They
assistance?
didn't come, so they have not seen those applications. I didn't get those 2, so they didn't go up. So,
Okay,
How much assistance for each of those?
8,400.
They're all the same.
They're all the same. That's the cap. It mirrors the Collins McDonald.
What's Steve
Headland?
study? What's his study course?
Bachelor's of Science in nursing.
In nursing?
Yes,
Oh, okay.
with OHSU.
Just didn't know.
And I'm sorry, so Amy Howell was not approved.
no.
All right. So Amy Howell, you should have received her information. She has also applied for the scholarship, and she's lived in Lake County for 26 years. And her current GPA is 3.6 for college, so she is also asking for. So you've got a total of 5 this year. One's been approved, and we're looking at 4 additional. So I would like to recommend approval of your additional 4 applicants. They all seem to be very strong, and I apologize if you did not get their information.
What is the fund balance in Patricia Gainey?
It's on the balance sheet and I don't have
Yeah.
it with me, sorry.
I looked at it once, but I didn't.
Yeah, you have to look at the detailed balance sheet, which is kind of why I sent it out. We do have the thing, excellent.
And it's $8,400 a year per candidate. unless-
Yeah, because we're gonna run out of money at some point.
Returns, it's split, sorry.
I'm sorry, just that compliment, I'll say it.
That's okay, yeah, no problem.
The columns are up to 9,000.
Well, it's 95,000, but we haven't, yeah. The ones that have come in, the last ones haven't been.
How much do we have committed?
Three people committed,
Okay.
so that's
So
gonna
we're-
come out of there.
We're getting down there.
Yeah, we are gonna.
Maybe one of the things that we should be working on is some grant applications from, I can get Christy Albertson to work on getting some grants from outside sources.
Let's talk about that in our training session.
Okay.
Okay.
I would like to move that we approve those applications.
I'll second that.
Okay. Been moved and seconded to approve the Patricia Gainey Johnson Fund applications as presented for the 4 candidates. All those in favor? 5 candidates?
No, for 4, because we've done
Yeah.
them already. So now, are these people going to KCC?
Um,
No, one's
Or
going
not?
to
One's
Johnson.
going.
One's going to
Oh,
KCC, one is through OHSU, oh, excuse me, 2 are going to KCC. One is through OHSU and Hope is through OIT.
Okay, okay.
So 2 are from KCC. And you approved Kelly Utley, who is also KCC.
Right, so we'll have 3 KCC.
3 KCC and 1 from OHSU and the other one from OIT.
Is it, so it's an OHSU program
No.
in Klamath?
Oh, yes. It's like a satellite.
Yeah, it's
Program.
yeah.
Yeah.
So they're both in
OHSU
Klamath?
Mhm.
So they're
program
actually,
at Oregon Tech.
yeah.
Right.
Right, so it's
Oh,
2.
so, yeah, I'm sorry,
So
you did
it's
1
just
year
housed at
KCC.
Oregon Tech.
Right.
It's an OHSU nursing program.
So we have actually 2 that are OIT, that are OHSU.
Right.
Yeah.
Any other discussion? Been moved and seconded to approve the applications. All those in favor?
Aye.
Passes unanimously. Okay. Medical staff privileging, Mr. Gallagher is not here.
Unfortunately, he is not. So I believe we have sent out to you a listing of all the practitioners, the resignations, the 2 radiologists, and more than likely the teleradiologists. That's part of the process. The renewals, the consulting radiologist, Dr. Fay, Dr. Brewer, courtesy urology, Dr. Knudsen, orthopedics, Knudsen, I guess. In Norway, it would be Knudsen, so what can I say? And then we have the additional individuals, Cambry Cotto, radiology, Jillian Bailey in orthopedics, and Evan Chalfin, provisional as a family nurse practitioner. These applications were presented to the medical staff at the most recent medical staff meeting. They approved it and recommended that you, as a board, approve these changes in status. In addition,
I'll move that we accept the changes as presented.
I'll second that.
Okay, been moved and seconded for the medical staff privileging to be approved as presented. All those in favor?
Aye.
Passes unanimously.
Charlie, excuse me just a second, Don.
Certainly.
That's part of the medical staff bylaws, is it not, and ours that we must approve these?
it isn't just the medical staff bylaws. That is a requirement for all hospitals.
Okay.
The way all credentialing works in all hospitals in the United States. Medical staff approves it, but the board of directors is responsible for everything that the medical staff does. The medical staff makes determinations on appropriateness for privileges, which is what this is doing. They're qualified to deliver service. But you're ultimately responsible as the board.
I'm with you on that, Judy, you know, as
Yeah.
we can't.
And I understand all of that, and that's just why I brought the question up again, because we've gone over this, because there would never be a reason, from my point of view, that we would ever deny that. Because personally, as a board member, I wouldn't know enough to deny what the medical staff is recommending to us.
There are times where you could override the medical staff.
Well, sure, I understand that we
And that
could.
may be because you, number one, know something about the individual who is a qualified physician, but for some reason, because of behavior, age, something that you had a concern about, you could
Oh,
overrule
I
it.
understand that, that's the reason.
Almost always, it is, your approval is pretty much expected. Okay? But that isn't always the case. Okay?
We missed the nursing report.
We haven't, so as part of my CE report, I want to start off with our nursing report.
I'm relaxed, I thought
Please.
I was off the hook. But we haven't done.
We haven't done, we got KCC agreement.
Oh.
Yeah.
Sorry.
I have a different
Jumping
agenda.
around.
You guys got on the same agenda that I
I accidentally deleted the nursing report by accident.
I don't have Teresa on my agenda anywhere.
I'm off the hook.
I figured now she's gonna escape.
did. You can on my own agenda. Okay, KCC agreement.
Thank you. I've sent out a copy to you, I believe. You have it in front of you. This is very similar to what we had in the last meeting. Dave has had a chance to look at it. He's made a couple of recommendations that, in speaking with Dr. Gutierrez this afternoon, I'm quite certain that they would be willing to do. The adjustments that Dave is recommending would be that in terms of if we elect to leave, there is a clause regarding the residual amount of payment. In the past, the way we paid for this is we waited until they billed us. We started out billing and they really they didn't stay current with their billing. What we're proposing doing now is paying them on a regular basis, helps remind everybody that this is an ongoing agreement. Secondly, as part of the agreement, it said, well, if you elect to terminate early, you would make up the residual amount. I want to make sure that that component says just for that time period.
Right. Yeah, it's not for the whole 3 years.
Not for the whole 3 years.
It's just be whatever's owed after the 60 days.
So the residual costs resulting from termination of the code invoiced by each party, you would change the wording.
Change that, and I changed it above where it says that the contract's a 3-year contract to make it a yearly contract that will continue for 3 years.
Okay.
So that it's not,
There's a contract duration and then a termination.
right. And I think we could add in the paragraph, the LDH will, we just put in there that they'll pay monthly. Instead of $75,000 for each academic year. Otherwise, you'd be stuck with $75,000 if you terminated 2 months into the academic year.
So a big part about this agreement is our concern has been that we have not been afforded enough involvement to encourage our students to get the best, not our students, their students to get the best training. And we have been assured, I think, in this agreement, as well as actively by the academic director and the president, that we would be actively involved on a regular basis. Teresa has been asked to participate in a lot of things, and even more so involving some of her staff doing the clinical work. It hasn't been finalized because they're asking us to agree to this. One of the concerns that we had was, as the agreement says, we had it, 50% of the students would come from Lake County. When we looked at the students that graduated and that were interviewed, we did have several students that could have easily have been 4 of the students for the class size, so 50%. But of the applicants, there were some very, very good applicants. And so what it really did is it helped us both for us to realize, as well as for the faculty here, that we need to make sure that we are producing not just students that meet the criteria, but students that meet and exceed the criteria. GPA has to be as high as it needs to be. The scores are as high, not just the interview. So we did end up having 2 residents from Lake County in the class of 9. So they started off with 8, but they were allowed by the State Board of Nursing to add 1 additional student, and that is another student from Lake County. Another thing we'll add, we don't need to have in this agreement, is that if they are residents of Lake County, they have to have been for more than just a month. Apparently, there was somebody who moved to Lake County from Klamath County in the hopes that that would get them guaranteed seat in the nursing school. It's a competitive program, and people will try to find the best ways they can to be accepted. So I feel pretty good that this is a partnership that we want to continue, and I would recommend that.
I haven't read this.
Pardon me?
Well, this didn't come out in my email.
No, it wasn't.
No.
This is the,
They just printed it
Just
tonight.
got it.
this is the agreement. We just took out the shaded changes part that I had presented last month.
Now, Charlie, did you say that we had 2 out of 9?
That's
Right.
right. Not the 4 out of 8 that we thought we would have.
2 out of 9 is not half of the
No,
class.
that is correct. But what the 50% says is qualified applicants. And for all intents and purposes, all 4 of the applicants that we thought would qualify, not all of them, when you looked at the GPAs or their scores, there were other applicants that were better.
So if we have a lesser than 50% and we're still paying half of the costs, is that right?
No, we're not paying half of the cost, we're paying just the amount that we have agreed to.
That's not half the cost.
No,
Okay.
no, it's significantly more. The cost is significantly more than our contribution. Our contribution is a significant amount, but the cost is quite a bit more.
What does the program cost?
I have not looked at their financials, but they tell me it's $1 million a year cost for the equipment, for the,
$1 million a year, and we're paying 75,000?
We're
We're
paying
paying
75 up
plus
plus
the
45.
Plus the 45.
Yeah,
up to.
up to. So we're
But
paying
that's
for
a
2
significant
people.
change from
half
what it's
2
supposed to be
people.
4. Now it's just prioritized.
No, it's not just prioritized, it's for qualified. So if we
But
have,
it's not most qualified. It used to be 4, that all you can do is qualify. Now you're saying it's 4 that are,
Well-
and they have to be the best qualified.
so frankly, I guess the question we want to keep asking is, do we want to have nurses that just barely pass the test? Or do we want to have good, well-educated nurses that work here? The answer is we do want to have qualified nurses. And we want to have them stay in Lake County. We want to make sure they have good education. Or they come here and they don't succeed. So it's important that we have good qualified nurses.
Well, let me ask this question. Does this, if we have 2 Lake County residents in the program, do we have any draw on the other candidates in the program as far as getting them here? Is there any incentive to get them here?
We have the opportunity to show why this would be a good place to go.
Do they come here and train at all?
We're in the process of working on that. One of the things that we struggled with last year is we anticipated that the students would do some of their clinical work and some of their classroom work here. And that didn't happen to the extent that we wanted. Didn't happen at all. And so we said we need to do this, and they at KCC acknowledged that it needed to change, and they needed our help to make that change.
We understood, or I understood, that some of the seat time could be done here in Lakeview.
Absolutely. Absolutely.
So I have a meeting next week. So one of the lead clinical instructor is going to come over here and bring 2 new clinical instructors to meet with us next week. And it'll be the first time that that's happened. And we'll be discussing how we can do clinicals here in Lakeview. We're hoping that our vision is the same as what theirs is, but you know, it's taking time, and certainly I think the work that Charlie's done is part of why some of that is happening.
One of the concerns that we had, and the students that were in this last year expressed to us, is they weren't able to have, we have this synchronous classroom here at the hospital, and they couldn't get their classes taught here, so they had to continually drive to Klamath Falls. Well, the biggest reason why that problem occurred is because we have 2 synchronous classrooms in the ILC, one here, and there are other synchronous classrooms in North Lake and in Paisley and in Gilliquin and a couple of other places that the school transmits to. And what they were doing, unfortunately, is those classrooms, they only had 3 classrooms in Klamath Falls that they could beam the classes from. And so they didn't have the capacity at their campus to put the nursing student classroom and beam it to our classroom here. What I've been assured this afternoon is that the new campus, the new facilities that they've added, have 2 extra rooms that have synchronous capabilities, and that opens up when the school year starts in 2 weeks, and they expect that they will have the ability to send the nursing class to the synchronous room what we have here on campus.
They've already contacted me because I've been scheduling all of the rooms now, and we've already set up and blocked out those times for the first years are doing this time to this time on these days, and the second years are these days. So they're already in the plans to make sure that once they have it beamed down, that room is blocked and ready for those students here.
Work
So.
in progress.
It is a process. It has not gone without its bumps. And we are pushing hard to get for our community the kind of education we want. If we're not getting it, I think your directive in the last couple meetings that we've talked about is if this isn't working, we need to terminate this.
Right.
And I believe that it's incumbent upon us to try and make it work, because it does benefit as a hospital as well as a community having this education. But if it doesn't work, we got to figure a different system.
Yeah.
I mean, I heard that loud and clear from you. I'm trying to make it, do what I can to make it work.
It's improving.
So I think you can anticipate that we will, from the nursing standpoint, have to provide somebody to be with those students when they're here in Lakeview. That's what the information that I got this week indicated, which was a little different than what we had expected in the past. So, I mean, honestly, that could be, I don't know, 10, 12 hours at least a week of one of our staff members working with those students. And I don't mean one of the nurses. I don't mean that they're just working with one of the nurses to give care. I mean there's a separate designated instructor to be with the students in addition to the nurses they're working with. So we have that potentially coming up. I think that my decision is that we're going to do what it takes to make this program work. I mean,
Does that mean you have to take someone off the floor to do that? Maybe?
At this point, I don't know what their requirements will be of that person, like what their educational level has to be. Because they also told me that they'll be talking with the Warner Creek Correctional Facility to see if there's clinical time that can be done there as well, certainly at Lakeview Gardens. And so all these different sites mean that whoever's with them has to go to those sites. So it looks, I mean, it's definitely a commitment, but I think if our students from Lakeview get to stay in Lakeview and get a good experience, it'll be worth it.
So are you concerned that they won't get any Lakeview students? So it just says prioritized?
Well, that's an interesting question. I think that what I heard when I was participating in the interviews and what I heard from our students that are already in the program is the people that are part of the nursing cohort that are from Klamath, they don't even know anything about this piece. They have no knowledge of this opportunity. They didn't go into the program thinking they were going to be doing clinicals in Lakeview. So I guess that remains to be seen. At this point, I wasn't thinking that would happen. I was thinking that the people that were going to be participating in clinicals here in Lakeview would be Lakeview, our county residents.
It could behoove us, though, in situation to have some Klamath students over here.
It could. So I guess the answer to somebody's question about is there an opportunity to pull people out of that program that might want to apply here, I would say yes, they could if they heard that, wow, the people, the clinical experience in Lakeview is better and they're a motivated student, they could, that's a possibility. It's something that did happen with the LPN program early on, the KCC LPN program. Students came over here for their clinicals. We didn't get any of those people though. But, it is a possibility.
But you haven't had an opportunity yet to discuss that.
No, and my hesitation would be that we can only handle so many students at a time. Because we don't have multiple floors and unless it's choreographed in such a way, that they're moving, there's people in more than one place, and then that would be difficult for us to handle. So, I don't know. It's a journey.
It's a work in progress. It looks hopeful. See how it goes.
And if we don't try, we'll never know.
Yeah.
Are you okay with that then?
What do you mean by that? You don't want to sign it?
With your changes, Dave, that's
With
fine.
your changes,
Yeah.
with the
Yep,
contract duration, determination, and then
it's okay with me.
Your changes aren't in here yet, Dave.
No, just vote on this one.
When you get that done, will you send those out to us? Just because I'd like to read that.
Yeah, I guess I just wrote notes on here, but I can show you those changed paragraphs. I'm not sure who asked about it.
I sent it to you, I'll send it to you.
Okay. Can I edit it? You can do that.
I would move that we authorize Charlie to sign this document as amended.
Discussion?
And you'll get a copy.
Oh. It's been moved and seconded that we accept the agreement for services between Klamath Community College and Lakeview Health District as adjusted, and let Charlie go ahead and sign it. All those in favor? Aye. Passes unanimously. Thank you, Charlie. Okay, next item, if I'm not mistaken, will be employee recognition.
No, we didn't do our nursing report.
I thought that came up
I'd like to add, as
Charlie,
Okay.
excuse me, can we bring this back on an annual basis or every 6 months and get it? I am really interested in the progress that this makes and where we are with it. I don't want to just say we're going to bring it and not have it back.
not a problem.
Okay. Are we adding an item in nursing report? Is this what I'm hearing?
It's part of my CEO report. So if you would want to go to the employee recognition first.
That's first. That's item number 10. I'm not in it for it here.
Okay, so our chair is sometimes,
I'm being obstreperous, but I'm following the script.
thank you very much for pointing that out, and we will follow that. So we've had a lot of things happening this summer, and when we think about all the moving parts, it's amazing how things happen. We've had lots of things happening with our orthopedic program. We are construction process, both in the gardens and the assisted living. Now we're into the clinic. But in the midst of all of this, there's been a lot of people doing a lot of things. And as we made the difficult change of moving from Lakeview Gardens in the long-term care facility into its new facility, there was a lot of work that went into it. And a lot of people put time into it. And Melinda and Larry did an exceptional job. It took a lot of work, and they did a lot of planning, and they really have done. It's not easy to do. Remember when we moved from the employees, or the patients that were in the old hospital to the new hospital, we treated it as a disaster drill. We did the same thing for when we moved the patients from long-term care into the new facility. What was amazing is the community in its support came out, and there were a lot of people came, and so all laid plans didn't go exactly as we anticipated because we had too many helpers. But in that process, there were 3 people that really stood out that I would like to recognize. Not just Melinda and Larry, but Mary Margaret Schultz and Sheree Morgan and Mary Ford. All of them did over and above to help make that move go smoothly.
I heard it was all done by 10 o'clock or something like that.
Well, there's parts of that were true. The patients were all in their rooms. Our plans to move beds and then move patients, make it less difficult. Well, when you had a whole lot of people, family members, we didn't want to have them moving beds. So we moved patients and got them in a little bit in advance. But it was a wonderful experience, and it went really well. So as difficult as the change is, it took a lot of work, and we appreciate all that they did. So,
Thank you.
Yes.
Next, are they going to split the prize between the 5 of them?
not quite.
Oh, okay.
Each one.
Each one, okay. Thank you, Carter. Okay. You can have your way now. CEO report.
As part of my CEO report, I'd like to start off with our nursing report.
I can't
I
lose.
barely have anything to say, except that the last month and a half, we've had a high census and been very, very busy. So that's my good news in terms of that, and our staffing numbers of agency nurses have been going down. We still have CNAs. I do have travel CNAs still. And then the thing that has taken so much of my attention the last couple months has been certification for the sleep lab. So we were notified that, and I may have mentioned this before, that we had to become a nationally certified sleep lab in order to bill Medicare for performing sleep studies on Medicare patients. So that's been a really big deal, bigger than we anticipated. And we submitted, about 2 weeks ago, we submitted our application. They reviewed it and let us know they needed more information. We had until today to submit the additional policies and data. So that went in today. So hopefully in the near future, we'll once again be able to do sleep studies on Medicare patients and Medicaid. So it's actually both categories. So it's a big deal. So that's been going on in the midst of everything else. So that's my report. I guess I will add that the CPR program, which we hired somebody to just coordinate CPR and to reach out to do community CPR. And I know we're doing classes nearly once a week now, which is quite a bit different. Sometimes twice a week. We've offered classes in Paisley. We did the school district last week. I think we did about 24 people, so that was quite a few. So there is quite a bit of CPR being done within the community and within the hospital. So that's been a change. That's all I have, unless you have questions for me.
Are we doing quite a few sleep tests without Medicare, Medicaid? Are we staying busy?
We're not staying nearly as busy as we need to. We're doing some. Probably about the number that we used to do, but not the number we got used to. So we're used to doing about at least 2 a week. So, and I think we've been doing about 2 a month.
Oh, wow.
So, yeah.
But soon that will change.
Hopefully. I'm hopeful, but I got everything in today. We'll see.
Okay.
We still have to undergo a site inspection. So they take it really serious.
Well, but there would be no reason that we wouldn't pick that number up against ones who are nationally certified.
Well, and more.
Yeah.
There's nothing to stop us once we're certified.
There you go.
Nobody in Lakeview sleeps.
Very little for sure, maybe.
It's the altitude check. Okay.
So if I can, thank you very much. So a couple of things. For those of you that went to the Destruction Derby over this great roundup weekend, you may have noticed that there was a vehicle that had a trash can on top. If you did, that trash can it was all about a fundraiser. And we received, Tom Lytle was the driver, Debbie Lytle, his mother, was involved, and Lauren Morris, his friend, and Jennifer Cooney was involved. Together they raised $2,790. It's not completed, and they donated that to our cancer fund. So they just handed that to me this afternoon. So that's pretty darn exciting that they raised that kind of money. And it was done in the last couple of weeks that they came up with this. So that's very exciting. And, it was neat to find out about yesterday. So I want you to keep in mind that we have our planning session next Tuesday. We have a lot of things to talk about, a lot of moving parts.
When are we planning to end that?
When or where?
When?
Duration.
Yeah. I just need to know because I need to set something for after. And I don't care, I just need to know.
What we did last 6 months ago, I think, was about 132, give or take.
Where are we meeting, Charlie?
We are meeting in the Street and Conference Room. So the next part of my report is that we have changed the dining room that was the old long-term care. That is now the Street and Conference Room. Which is at the far end, in long-term care.
Yeah.
It's on the far west side. So if you go down the corridor here to the very end, that's where the old nurses station was. To the right, where the entrance was. There were 2 sides. One was where they had a TV and piano, and on the other side is the dining room. That is now our Street Conference Room. And we will be holding most of our CPR classes in that room. We'll be able to store our CPR mannequins and other supplies that they need to But we have a constant need for conference rooms. Has a little bit of a kitchen there, so be able to heat up coffee and water and that kind of thing. So, and the employees chose a couple of years ago when what is now the pulmonary rehab center that used to be our classroom, that used to be our physical therapy, next to Dr. Grant is the Warner Mountain Clinic. Employees all chose the name as the Strebe Conference Room in honor of Dr. Strebe. We have now relocated that to the classroom, or to the dining room space.
And that makes that space now eligible for Medicare reimbursement, correct?
Absolutely. Absolutely. So, so we'll, roughly about 2 o'clock, between 1:30, or if you all say I'm done, we've covered enough. Because there's a lot that we don't want to burn out. We have several students that may or may not see around. We just took on a student in our lab who's learning to be a phlebotomist and learning a lot about what happens in the lab. We have physical or physician assistant, PA, who was working with Dr. Grant and is rounding with him. She will be with him for, I think, a month or 6 weeks. So, and then of course with the KCC students, we have a lot of education that's going on here. That's really a great thing for our community.
We have a pharmacy student.
Pardon me?
We have a pharmacy student.
We have a pharmacy student. That's right.
We have some high school students that come over with the career.
We've had high school students for a long time. And that's, thank you for reminding me. Bobby Stinninger's program has been really
Starts next
exceptional.
week.
So as you all know about it, and I guess there aren't anybody that are recipients of Bobby's class or participants. But we just finished up our, as part of the CHIP program, the food program, the lunch program, which went over really well. And that was an exceptional thing. Next week, during the school, we're participating with Advantage Dental in the dental sealant program. So we're putting up signs, even the Oregon Health Authority is putting up signs saying this really is a good thing. So we encourage parents to have their kids get the dental sealant program. It really is a wonderful.
What's the age grouping for that? Is that all elementary?
Oh no, it goes up to.
Is it K-12?
I don't know if it's all the way up to 12th grade, but pretty close. And they don't want to do it just once a year, or just once and then it's done. They want to do it as often, at least once a year.
So you don't really know what the age?
It's predominantly focused on the younger children, but I think it goes up to 8th grade at least.
Yeah, I think it's up through the middle school is
Oh, like 8th grade,
something I
7th
thought,
grade?
I think so.
But it is a wonderful thing, and we've been trying to do this. It's been pushed throughout the state. The county has not been quite as participating as many other counties, so we're putting a big push. And Advantage Dental is really helpful in that. So we're excited about that. Judy and I went to a JPIA meeting on July 16th. And I have another meeting tomorrow in Cedarville, where we'll be talking about ways that we can work together. So, do you have any comments about that meeting that you brought up, or is it improving that?
Gosh, I've actually felt this time that there was a little more enthusiasm in working together on some common goals. Where I think we've gone for as long as it's been started, kind of not sure what we can do together, but it seems to me that maybe we may come together with something one of these days. I felt a little better about it anyway.
Well,
And you're meeting just with the CEOs, aren't you?
and they're anxious to try and find more ways to work together. Certainly do. One of the things we've talked about is telehealth. We talked about orthopedic surgery. We talked about cardio. A lot of things. So
We talked about bringing their students into the KCC program?
We have, it's hard for them because when they send their students up here, they don't go back. So they're not interested in sending their students here. So
Okay.
we have to watch that a little bit because that's not always,
Is that an out-of-state type of tuition for them to pay?
no, it is considered in-state.
It is, Alturas is.
So what KCC does is any county that is contiguous to Klamath County, they will treat as in-state. So that's how they're getting around that.
Somebody from Nevada then.
It's not contiguous to Klamath
Oh,
County.
Klamath County.
So,
Good try.
we're involved in a rural health listening tour. So we had people from OHSU and the Office of Rural Health come out here. They had done this last year. We thought originally they were here to have us hear from them, and they're more interested in hearing from us about needs that we have. We talked a lot about our needs for them. When we talk about, you heard about our volume of radiology visits and how we continue to be staying fairly strong in that. Kyle Byers, our radiology manager, reported yesterday, after having done an analysis of the scans that we've done since we got our new GECT scanner, and evaluated how much radiation we are giving to patients. In the 8 months since we've had that new CT scanner, our dosage is 36% of what we have done in the past. That's a significant less dosage than we have done. And that is just going from an older model to a newer one. It's that much better for our community. So that's really exciting news to them.
Nobody glows anymore.
Like the fireflies.
We finished today our Gobi requested evaluation. As you know, we have a contract with Gobi for our wellness center. And they had done an evaluation last May, June, when it was still Lake County Mental Health, and they had a list of things that needed to be worked on. It was sort of a help us to focus our attention. We had a contract that was a 7-month agreement from Gobi that started a year ago, September 1st. And they came back and evaluated how we were doing and found that we had met all the requirements, that they had found the problems found in the first evaluation. We were doing very well. We've been very pleased with that. So we asked them to come and look again. And what they're really doing is thinking of it like a funnel. We start out with a lot of problems out here, we've directed, now they're becoming really focused issues that we are working on. And the litany of things that we have to do to get better really will help us do even that much better. So let's just reporting. Some of it is ways that we can get better. But all in all, they said we're doing better than they expected. So that's good news. Clinic remodeling has begun. We did have one cost savings that, there's a lot that's going to be happening, but one of the construction costs we anticipated, there's a sewer line that runs right through the middle of the buildings underground, of course. And it was anticipated, because of the age of that sewer pipe, we were going to have to put a sleeve in it, about 120-foot long sleeve. They evaluated and found that we didn't have to do that. That alone saved us $60,000. So that's a positive.
Is that clay pipe?
No, it's concrete. And they ran a camera in it to look at it, and found that it was in great shape. So that was a great savings. They anticipated it was going to be a clay pipe
Yeah.
or cast iron or something, and that they were going to have to put that sleeve because they had no idea the condition of the inside of the pipe. So you find those other kinds of savings, that would be great. I wouldn't hold my breath, but that's where the process is. Other than that,
Reading the minutes from last time, we were talking about flu shots and nurses getting educated to try to take them. When does that start? When do we actually have flu shots available?
I think we will start October 1st, roughly.
The flu shots will become available for employees in October 1st or right after. The flu season and the mask requirement will start dependent on the number of cases that we have that are tested positive in our lab, and also what the state lab tells us. So Mesa will use those two things to determine the mask on date. So they're separate.
I also,
And it's bumpy.
Did
If you want to know how it's going, it's bumpy.
Did you want
That's
a
what she-
copy of
that's
those?
what she told us. Did she tell you that? She
Did
told us
you
that.
want a copy of those policies so you can see the parameters, or?
Oh, I read them. I think I read most of them.
Oh, okay. Oh, so you got them.
I think we
They approved it a
covered
couple
it.
months ago.
I think it is part of our society today that many people are reluctant to have immunizations, and you know, those of us that are, some of us have a hard time understanding resistance, but you know, there are those that have lots of excuses of why.
Just tell them they're organic and they'll take it.
We have a new organic flu vaccine, I like it.
One thing that, God bless you, one thing that I did not add is, as part of the construction of the clinics, we were very, very pleased that the school was gracious enough to allow us to use the space to the north of 6th Street, where we're going to be parking both in construction vehicles as well as supplies. That was really an exceptionally positive thing that the school did.
I saw that, yeah, they got no pen problem.
Yeah.
Yes, so, and they were very happy to accommodate us and accommodate our patients, because it does make it difficult for parking.
Right.
We're trying to do all we can to accommodate our employees, but mostly our patients. So, that concludes my report.
Okay. Any other questions or issues? And for executive session, we have some issues for executive session. Okay. We will go, let's see, into executive session under ORS 192, 660, bracketed 2, bracketed A, personnel, bracketed C, medical staff, bracketed H, legal, and bracketed J, property.
Yes.
Okay.
And in attendance will be board members, Dave and myself.
Okay. With that, we'll take a 10-minute break. Thank you, folks, for coming.
Thank you. Keep up the good work.
Yeah, absolutely.
Do our best.
Get that assisted living open.
It sounds like we might have to build another one.
That's a possibility.